Arresting a fall is only first step of preventing injury or death. Even if the fall cause doesn't any injury, still the worker can die from suspension trauma, orthostatic shock if not rescued in time. What is suspension trauma? Suspension trauma happens when a fallen worker suspended in the harness with legs hanging while arteries in the front of the leg continue pumping blood. The harness straps act as tourniquets on the veins in the backs of the legs and prevent oxygenated blood returning to the heart. If circulation is impeded enough, the heart rate will abruptly slow and reduce oxygen to the brain. So, suspension trauma shall be treated as an emergency. It can be fatal as little in 10 minutes, and typically, suspension trauma causes death in 15 to 40 minutes. Most of the people, HSC personnel, or the site supervisory staff or the project team, they feel that the person is hanging, he is safe, no problem. But if they will not rescue the person in a short span of time, there is chances of death because the blood flow is being stopped towards the heart. And in this case, what will happen? Brain will not get sufficient oxygenated blood, and this may cause death. Most of the time, suspension trauma is not part of the business, is not part of the risk assessment and method statement for working at height. This should be considered by all HSC practitioners at their earliest. What are the measures? How we can reduce the risk of suspension trauma? All workers should be trained that suspension in an upright position for longer than 5 minutes can be fatal. This need to be understood by the people, by the workers. Those are involved in working at height activities. Those staff who is supervising the working at height activities, they should know that they have to move their legs in the harness and try to push against any footholds. The best way to slow the progression of the suspension trauma is to stand. A fallen worker can stand in one or several ways by using suspension trauma relief straps with the help of outside work equipment, aerial lift or ladder, technical rescue equipment along with chain rescue team, main lift, pulley or wing system or brake tube systems. Remember, after the rescue, still there is extreme chances of death if a victim is moved too rapidly to the horizontal position. Moving a worker too quickly to horizontal position is likely to allow a large amount of deoxygenated blood to move to the heart that can cause immediate cardiac arrest, heart attack, and death. So it is important to keep the worker in the sitting position for some time before horizontal posture. This is the point. Very, very important point. Once the person was rescued, everybody is happy. The job is done. Not yet. What is required? Once the person is being removed with the help of crane or main lift basket, whatever, it is required to keep that person sitting for a while or standing for a while, because if he will immediately lay down, the blood that was tourniquet, that was stopped because of harness, will suddenly rush towards the heart and it will cause cardiac arrest.